Hello, thank you for watching this video on confidentiality, specifically the confidentiality that exists between victim advocates and people in custody. My name is Tara and I work at Just Detention International. Just Detention International, or JDI, is a health and human rights organization that seeks to end sexual abuse in all forms of detention. We work with corrections officials, rape crisis advocates, and policymakers to make detention facilities. Just Detention. In this video, we will discuss trauma and sexual abuse. Some of this may be difficult to hear. If you have concerns, please seek guidance from your supervisor before watching this training video. During your time working in this facility, you have probably learned about confidentiality that applies when incarcerated people reach out for emotional support from local victim advocates. This is a topic that corrections officials and facilities around the country have raised questions about. And in this video, we hope to provide some further information on this issue. The National PREA standards and this agency's policy requires that people held in this facility be able to communicate confidentially with advocates from a local victim services program. Keep in mind that there is a separate requirement that people held here be able to report sexual abuse or sexual harassment to someone outside of this facility, an outside reporting entity. I know as corrections staff, you want to keep the facility safe, and staff as a whole does this by knowing what is happening in your facility. So the idea that someone in your custody could disclose sexual abuse confidentially to a victim advocate without necessarily reporting it to the facility can seem alarming. In this video, my goal is to help you to understand how confidentiality works in this facility and to be able to explain why any communication between people incarcerated in this facility and victim advocates from the community must be treated as confidential, and why this is important not only for the individual seeking services, but to overall facility safety. When something is confidential, it means not sharing the information with anyone. For example, when an incarcerated person meets with their lawyer, this is considered privileged communication, meaning that it is confidential and what is shared with the lawyer cannot be shared with anyone else without the client's permission. Communication with community-based victim advocates or rape crisis advocates is also considered confidential communication. This is true for anyone who meets with victim advocates in the community or in confinement. These guidelines are mandated under state and federal law and are a part of a victim advocate's legal and ethical obligations. Victim advocates provide services in a number of ways. These include letters, phone calls, emails, and even in-person visits. You may be wondering what confidentiality looks like for each of these. Let's start with letters. Confidentiality in letters with a victim advocate means that the letters are treated like legal mail, and only the recipient can read them. It also means that mailroom staff do not tell others when they see outgoing mail to a rape crisis center and cannot read that mail. For phone calls, this means that the calls are not monitored or recorded. Know that advocates are trained to maintain boundaries with all callers and to manage off-topic or inappropriate calls. In some cases, advocates will come to the facility to meet with people one-on-one. They will try to meet in an attorney room or another place where their conversation is confidential, meaning security staff are not in the room, but are posted just outside and are able to maintain visual surveillance. Unlike staff in this facility, victim advocates are not mandated reporters, so they will not share what an incarcerated survivor discusses with them, except under very limited circumstances. Of course, as facility staff, if you become aware of sexual abuse or sexual harassment occurring in the facility, you are required as a mandated reporter to give that information to the designated supervisor or facility officials so that an investigation can be conducted. Keep in mind, however, that the PREA standards require that staff treat information related to reports of sexual abuse with discretion. That is, if an incarcerated person tells you they have been sexually abused, for example, once you have reported it as required, you must not reveal any information related to that report to anyone else, except those who have a need to know in order to respond to the incident as required under agency policy. Specifically, only people involved in the investigation, medical or mental health care, or other treatment have a need to know. As you know, sexual abuse is traumatic. Advocates are trained to provide emotional support, crisis intervention, information about reporting options, the investigative process, referrals for services, and offer coping skills and self-care strategies. Advocates do not tell someone what to do. Rather, they empower survivors so they can make decisions that they feel are best for them. Sexual abuse survivors are more likely to reach out for help if they can do so confidentially. When first contacting a victim advocate, survivors are often overwhelmed and need help deciding what to do next. An advocate can validate their feelings, review their options, and help them to develop a safety plan. The truth of the matter is that speaking confidentially with a victim advocate does not make survivors less likely to report sexual abuse to the facility. In fact, facilities that allow confidential communication with an advocate send a strong message about staff's commitment to ending sexual abuse and keeping survivors safe. A commitment that promotes trust in staff and in the reporting process and contributes to safer facilities. We have talked about the ways advocates communicate with survivors, and in most cases, these conversations are confidential. Before an advocate provides services to people in custody at your facility, there have been lots of discussions about those services and agreements about any narrow limits to confidentiality. Following this video, someone will share information specific to this facility, but these limits may include the survivor sharing that they may harm themselves, someone else, or try to escape, or information is shared that a child is in danger or is suspected of being physically, sexually, or severely emotionally abused or neglected. Your facility will share with you, as well as with people incarcerated here, the limits that apply to confidentiality of communications with outside advocates. Advocates will also share these limits when they meet with survivors. Just like survivors in the community, incarcerated survivors of sexual abuse need and deserve confidential support from rape crisis advocates. When they are given adequate information about the services that are available and any limits to confidentiality, they can determine for themselves if they want to reach out for help. Sexual abuse is traumatizing and intensely personal, and most survivors never report. When survivors receive compassionate, non-judgmental support from an advocate whose only concern is the survivor's well-being, they are much more likely to begin to heal and more likely to, when survivors report the abuse and seek other support inside the facility than if they did not have access to those services. Ultimately, they will be more likely to get help when they are released, leading to better outcomes and a lesser likelihood of recidivism. Thank you for your attention during this video. For further information and resources, please visit JDI at justattention.org.